Welcome to the Renee Report, bringing issues of topical interest. Renee Mehra, and welcome to the Renee Report, bringing issues of topical interest. Today, my guests are going to talk about men's health, prostate gland health, because we see that prostate cancer affects men. It's one of the most prevalent cancers in men. And according to the American Cancer Society in 2017, there are going to be over 161,000 cases, new cases of prostate cancer. And there are going to be over 26,000 fatalities. And what we're going to talk about today is about detection, prevention, the risk factors, because there's going to be an upcoming mega event that's going to be the International Prostate Symposium that's going to be held by the Mount Sinai Health System. And that's going to be from September 6th through the 9th in New York City. And telling us all about it, we have our guest today, Dr. Ash Tewari. He's been here before. Thank you so much for coming. Dr. Tewari is the chair of urology at the Mount Sinai Health System. Thank you so much for coming back again, and this is so very important, as we talked about that men's health, because it's very important. You're going to be talking about the symposium and what we can expect this time in 2017. And joining Dr. Tewari, we have Anthony Lutz. He's a nurse practitioner at the Mount Sinai Health System. Thank you so much for joining us, Anthony. Welcome aboard. And Macy Robinson, an RN with the Mount Sinai Health System. Thank you all for coming here today. Very, very important, talking about men's health and talking about prostate cancer. As I said, it's very prevalent in men. And the good news is, this is all the bad news, but the good news is that it can be prevented and the morbidities can be delayed if we pick it up early in time and the person follows through the whole treatment plan. So tell us, first of all, what your department does. I'm going to go back to the International Prostate Symposium, which you were recently attended in Boston as well.
Yeah.
But tell us what your department does, how you create that awareness in patients and people who need to know about the risk factors.
Thank you, Renee. What you're highlighting is a very important issue for men. Not only that, we'll be diagnosing over 160,000 patients this year. Every 18 minutes, we are losing one patient in the United States.
That's scary.
So we have made major strides in finding cancer in a timely manner, but we still have a lot to do.
Right.
Our battles are on both the sides. On one side, we have to be a little smart, more discreet, more deliberate in as to who and when we intervene to find prostate cancer, because many a times we do biopsies which could be avoided.
Right.
So we are leveraging imaging and genomics in developing that kind of a program. On the other side, we are dealing with cancers which are already relatively advanced, and we are looking at immunotherapies and we are looking at adjuvant treatments that can help patients on the both sides of the spectrum. So depending upon the diversity of the kind of a cancer we are dealing, we have developed a department which is very diverse. We have experts on different areas. We literally call our department of hedgehogs, meaning expert on certain aspect of the disease. We have over 33 full-time urologists who are working as a group in the Mount Sinai Health System. We have many nurse practitioners, nurses, NPs, PAs, and researchers who are sharing the common goal, that is to find a better treatment for the urological disease and more so about the prostate cancer. And that is how our program is structured, to have the best team member handling the right aspect of the problem. And two of my elite members are here.
Exactly, that's interesting. And Mount Sinai Health System has 5 hospitals, right?
Yeah, we have multiple hospitals, the Mount Sinai main one, the Beth Israel one, which is known as Mount Sinai South. We have Mount Sinai West, we have St. Luke's, we have hospitals in Queen, we have hospitals in Brooklyn. We are affiliated with the Elmhurst Hospital, which is a sister program. We have a combined residency program in which we take residents, 4 residents every year. We have fellowships, we have research lab which is trying to find different solutions for this major problem.
Yeah, That's interesting because we need more innovative solutions to address the problem.
That's right. We have to think outside the box to tackle this problem.
Right. Now, tell us what we can expect. Give us a snapshot of what we can expect at the International Prostate Symposium that's going on from September 6th to the 9th.
That's right. This international symposium is one of its kind, where one of the best minds in prostate cancer and other urological cancers are getting together to solve a problem. And problem is that how can we reduce morbidity, do a better treatment, prolong life expectancy, and still manage to give a great quality of life. I must say, I have a co-director in this program, one of my best friends, Dr. Ketan Badani, who currently is traveling to California talking about genomics in cancer, is helping me with this. But in addition, we have a whole team of about 20 people who is located at the Mount Sinai Health System, along with over 100 international faculty who are coming here just to have a point counterpoint, talk about different innovations, discuss the different surgical treatments which are out there, discuss pros and cons, allow people to kind of synthesize and come up to a consensus. Findings of this program, findings of this meeting is going to be published in 2 major journals.
I see.
And hopefully at the end of it, we will have something unique, we will have something better with which the patients can benefit.
Okay. So, and this is going to be a 3-day event, and it's going to be attended by doctors, clinical personnel, as well as patients and caregivers?
It's predominantly targeted towards not only just physicians, but anyone who has an interest in prostate cancer, be it as an end user,
Right.
or be it as a participant, or be as a researcher, anyone who is knowledgeable, who has a risk, and obviously for the physicians from all groups, medical oncologists, internists, primary care doctors, and obviously urologists. A lot of people are coming just to observe different 3-dimensional high-tech surgery which will be displayed during this procedures. Many of us are experts in doing a certain operations, and people will be there to observe, learn, and possibly take it home and help their patients.
Yeah, because many times caregivers and patients, they want to talk about their lived experiences, and that also helps the clinical side of people's prevention and treatment. So they hear the narrative, and it's you learn so much from there that you're able to modify a lot of treatments based on what they're talking about, like more culturally sensitive. Specifically, the interventions that are very specific, where they're culturally specific, it really works well for positive outcomes.
No doubts about it. We as a doctor, we think that the best lab for a physician is an interaction with the patient and their family. They bring in the solution sometimes. They bring in a totally different perspective. And being able to communicate with them, listen to them, communicate in an ethically sensitive way is a privilege and is an asset which we all need to have. And events of this kind gives my team, the researchers, the nurse practitioners, the PAs, the nursing staff, the physicians, the residents, and the PAs to kind of get first-hand feedback from those who are experiencing on the other end, and obviously get a feedback and interaction with the other physicians who are experts in doing this kind of a treatment to their hospitals, to their patients. So it's a unique opportunity.
Yeah.
We are excited
specific
about it.
interventions for specific cultures to get sustained outcomes that really works well.
You
So,
have to tailor it to an
absolutely.
audience.
Yeah.
You have to tailor it to a particular individualized approach.
Right. So, Macy, tell us, you deal a lot with immunotherapy, and one of the
Right.
topics I see, I think on the 7th day, September 8th, I think it's about
Right.
immunotherapy
Correct.
and success with that.
Right.
So share some light on that.
Well, for the immunotherapy, I actually work really closely with all the patients once they come in, and Dr. Tewari sees that they're a candidate for the immunotherapy. Me and my coworker Cindy, we're actually the ones that hold their hand throughout the whole process. Like, we
Right.
meet with them in the beginning, we explain to them the entire treatment and how it's going to go. We help them schedule their appointments. We're there when Anthony does the administration.
Yep.
It's a teamwork effort,
Sure.
stemming from all of us, and it's really wonderful to get to work so closely
So how
with
long
them.
does this immunotherapy last? Is it, of course, depending on the intensity of the disease?
Right, and it's what we're working with right now in particular with Dr. Tewari is the poly-ICLC. It's a 10-week course. The first injection is actually intratumorally into the prostate, and then over the following weeks, we actually give the injection intramuscularly.
Okay.
And after 10 at week 10 is actually when the patient will go with Dr. Tewari and actually have the prostate removed at that time. But the immunotherapy is in hopes of building the immune system to help fight the cancer.
So it helps to enhance the immune system.
Right.
And
it does.
this is the 10-week period that we're talking
Right.
about. Okay.
And they wait the 10 weeks, go through the treatment, and then go with
So
Dr.
do you
Tewari to surgery.
monitor every week?
Yes,
Yeah.
we do. Blood levels. They come
Lab
in,
tests, yeah.
They come in for a physical with Anthony and things of that nature.
So
it's
Anthony,
really great.
Macy, both of you work, and obviously it has to be a teamwork.
Right.
That's how the flow and the connection comes in. And you see a lot of patients with their caregivers who are there. What have you, learned from those experiences? Because I personally believe that the lived experience of a patient is very, very important to bring into the interventions, which I always say there should be specific interventions for different people. And the lived experience really brings that qualitative data that you incorporate in your treatment.
Exactly, and I think too, one of the things that's most exciting about the work that we do here at Mount Sinai in the Urology department is it's a collaborative effort between us and the clinical staff, the research staff, the physicians and the surgeons that we work with. But really, the most important person in that relationship is the patient and the patient's family. And so each treatment that we do personalized to that person, but also personalized to their situation and to their family. And each interaction that we're able to have with patients and seeing them from the very beginning, prior to, during any treatment, afterwards as we follow them for years afterwards, we learn something from them each time, and tailoring then how we can best care for them based on how they handle the treatments that we do, and how their families are there to support them, and not only supporting the patient, but supporting their family as well. And I think one of the most exciting things for me on the clinical side is as we follow patients, during treatments and after treatments, and help to maximize their quality of life and how they handle treatments and move forward dealing with this disease, and also after treatment for the disease, is when we get to see them thrive afterwards and help to kind of try and create the most holistic approach to caring for them in their lives and keeping them overall very healthy. And even just, the other day in clinic with Dr. Tewari, patients living for 10 years after their prostate cancer surgery. So excited to see us, that get down and do push-ups in the office and celebrate. And Dr. Tewari will do push-ups with them. So it inspires the patients then too to really live their best life and to be as healthy overall as possible.
I think that's a celebration of life, and you actually learn from those experiences when they talk about it. But many times you've seen disadvantaged communities or minority cultures, there's a lack of compliance because they don't understand certain treatment protocols. So how do you address that issue so that you talk about culturally sensitive care, but many times that compliance comes in because there's lack of communication between the clinical person, the doctors, the physicians, and the patient. They're not understanding, and the translator gets something else in the picture. So how do you address those issues? And I'm going to go back to Dr. Tewari on certain other treating.
It's a great question, and I think each interaction you try to use all of the tools that you have, and some of those tools being the family members to help you understand best their living situation and the situation that you have at home with the patient and their family. Trying to stay up to date on research and continuing education opportunities about culturally sensitive care, and learning about different communities, being out in the communities and learning about activities that go on so you can stay connected, not just in the clinic, but also outside in regular day-to-day life where you see patients living every day. And really trying to keep the communication lines open, which I think, one of the most important things as we deal with cancer patients every day is it's not just questions about the cancer that come up. It's questions about their life and how they continue to live on, and how they, go about dealing with other medical issues too. And so any way that we can help and be available to be a shoulder to cry on, or a person to laugh with, or just someone to listen to them. And I think the more that we can do listening, the better. And then helps us to learn and provide better care.
Listening is the fundamental part in this whole thing, because you learn so much from what they're saying, and you actually understand, oh, so this is what it is. And it's not just about cancer, it's a whole life as a sketch. So Dr. Tewari, both of them work together, and I'm sure they work all together with you, because that's how you get sustainable interventions and positive outcomes, and reducing disparities in healthcare in our country, which is so badly needed at this point of time. Tell us about this 3D robotic surgery, because that's so important. That's something that you have been working on. I don't remember, it came last time, you talked about it as well. So where are we at this point with 3D robotic surgery?
I think this surgery has been refined quite well, and it's quite safe. And it can help a lot of patients who have a cancer which is still within the prostate or around the prostate, but can also be extended to kidney tumors, to the bladder tumors.
I see.
We are routinely doing not only prostate cancer surgeries, but also surgeries for the bladder cancer, half of the kidney cancer surgeries, and anywhere where you need to be precise, anywhere where you need to have a magnification, and anywhere where we need to have a reconstruction, putting things back together. I think this robotic platform and in 3D is giving us an edge. And with the minimization of the bleeding and all those things, it makes things easier for the patient. They bounce back sooner, and the outcomes are mostly very favorable.
So which patients qualify for that procedure?
I think let's focus on prostate cancer. So from in prostate cancer, I spend most time thinking about who does not need a treatment. So I have a very busy and active surveillance program in which we find cancer, but based on the biopsy, based on the genomics, and based on the imaging, we put a lot of patients on what we call an active surveillance.
I see.
Meaning we don't just intervene, we keep an eye on them, we repeat their imaging, we repeat their genomics, we repeat the PSAs, we repeat exams, and if and when the cancer shows a trend that it is progressing, it declares itself. If it does, we intervene. So the cases which are ideal candidate for treating it robotically are the patients who have a good life expectancy, meaning they should be otherwise medically fit, they should have more than 10-year life expectancy. They should have a cancer which should be Gleason 7 or more. Cancer preferably should be within the prostate or in the neighborhood.
Right.
And that is the one which you can literally cure it. Not only that, you can cure it, most of them, if the nerves are not involved, you can save the nerves and give them a good quality of life. You can do some reconstruction to help them with the urinary function and all those things. Off late, with more aggressive cancers presenting to us now, what we have started doing is to have in trials in which we do a new adjuvant setting, and that's what Macy and other people are working on it. There is a likelihood that the cancer will come back even though we intervene, and any treatment, the likelihood of cancer coming back is there. So how about enhancing the body's own defense mechanism by launching an immune therapy before, by stimulating the body's T cells to recognize the bad antigens which are present on the cancer cell, and let these cells circulate in the whole of the body even before we are going to get them out. This setting is known as a neoadjuvant setting. We stimulate the system, we go ahead and take the cancer out, and later on we will keep stimulating it by the intramuscular injections. So different domains, different approaches can be taken to sort out and expand the role of surgical treatment along with the radiation and the hormones and the chemotherapy. Immunotherapy is playing a major role, and we are very excited about it. And these are the kind of discussions we are going to have with the world's best experts during this forum.
Wow, that's interesting. And so the experts are coming from 5 different hospitals.
Oh, experts are coming from 5 different hospitals, 10 different countries.
Oh, different countries. Well, that's why it's international symposium.
We have over 100 people coming.
Wow, the best minds coming in there.
The best minds in the United States, Germany, France, Sweden, Amsterdam, India, Europe. They are coming, gathering together just to kind of sort out a problem. And it's a very collaborative process.
That is wonderful. Now tell me, talk about PSA levels and how good it is just to know from that. Is it a good indicator of
I think
illness,
PSA
the
is
disease?
just a test, and
Nothing
how we
more.
use the test
Is what how you interpret
what
it is when you move
determines
it forward.
what the outcome will be. And more than that, PSA has been updated by many other modifications, and if you combine 4K test and there's a new kind of PSA
see.
test, and if you do PSA density, if you look at the velocity of the PSA, you measure the prostate volume and see what's the ratio of the volume versus
Right,
the PSA,
right.
we call it PSA density. You can also do imaging, and of late
Yeah.
we have a major investment in using imaging for detecting prostate cancer, combining it with the PSA,
Yeah.
what I call why men don't have a mammogram. So same way, we are trying to develop a protocol in which a
wonderful.
easy, simple MRI can guide us who needs a biopsy, and if they do, that biopsy doesn't needs to be a blind
Right.
biopsy, rather it could be a directed biopsy exactly at the area where MRI shows a lesion.
So have they started that?
Of course we are doing it.
Oh, they have, and I think that's
We are
that's
doing
an
a targeted
interesting
fusion
part.
biopsies in our program quite a bit.
So let's say if my viewers are watching, some of them may not be physicians and some may be physicians, but those who are lay people and they want to know more, get a sound knowledge, a good knowledge about, hey, what do I do if my near dear one needs to, you know, is it genetically, there's a genetic predisposition, what are my risk factors, what are the symptoms, if you can just give them a good idea about that so they are able to spread the news about this.
So I think anyone can have prostate cancer. We usually start looking for prostate cancer in men beyond 50, 55 years of age. If men have a family member like father or a brother, or if they are of African American descent, then we start a little early because they have a greater risk of developing prostate cancer. Patients who were exposed to some chemicals or radiation in some event, they are also at a higher risk of developing prostate cancer. Inflammation anywhere in the body is a risk factor for prostate cancer. Genetically, there is a data coming out that the same genes which we were implicating for the breast cancer, BRCA gene, they are now being associated with a more aggressive kind of prostate cancer. So knowing the risk factors for the breast cancer amongst the family members, melanomas, colon cancers. So we have a program, and in fact that program is being developed with the Dubin breast cancer program at Mount Sinai, and one of my collaborators is Dr. Lisa Port. Elisa and I have been talking about the breast cancer and the prostate cancer link, and we have a program, what we call Gift from Fathers to the Daughters and Mothers to the Son in Better Understanding and Prevention for both cancers. So we are learning, we are joining hands and sorting out this problem at the genetic level, what can be done to minimize both risks.
Right. That's great. Now I see that you also have a topic called live surgery that's going to be happening on Friday, September 8th.
Yeah,
So,
they will be.
so what are we expecting that? That's an interesting topic.
Yeah, that's a surgical forum in which different experts get to observe you. You'd go ahead and quietly do what you need to do to take care of that cancer. And at the end of that surgery, everyone gives you a feedback what more, if possible, could have been done. And that is a platform for surgical innovation. That's a platform for how surgery has evolved. And that is the main, one of the draws for this kind of an event, which we'll be doing multiple of these procedures.
And so the program starts every day from 7 in the morning. It's a
Yeah,
long
we
day.
start early. We start from 7 to 7. And there'll be a lot of coffee and lunch.
Yeah, I'm sure
and,
there is.
But I think this is not for the weak hearts, it's for the strong ones. And we intend to have what in CME terms, more than 26 hours of CME, which is a continuing medical education opportunity for doctors
Right.
to get into
So
this.
it's from 7 a.m. to almost like 5:45 p.m.
Yeah.
every day. The last dates, I think, it's till 3 o'clock.
That's correct. That's correct.
So it's from 6th to the 9th. It's the International Prostate Symposium, and that's held at the Mount Sinai Hospital Stern Auditorium, which is on 100th Street and Madison Avenue. And those who would like to attend, if you do mention ITV, that you watched this program on ITV, you get a good
Very
rate
subsidized,
for
very
this. Yeah,
subsidized program
rate
based on
that.
where you come from. And you can email it to Anthony or the phone number for Maureen, who is working with me.
Right.
They can take care
Yeah,
of it.
and Anthony's email is right up there. It's,
And there's a website address there,
Lutz
which
at mountsinai.org. And Anthony and Macy, do you want to add something more, because you deal so much with the caregiver and the patients, and you're in touch with them. It's so there's that sensitivity that comes in from knowing about them and learning so much from their experiences.
For me personally, like I lost my stepdad to cancer, so working in the cancer field for me is incredibly important because I've been on the other side, and I know how important it is to have people in the healthcare field work with you and really care about where your feelings are and where your heart is. And to me, that's what's the most valuable in doing what I do every day.
Yeah, you're coming from that personal
Right.
perspective. Yes,
Right.
I understand that. And Anthony?
Yeah, I couldn't agree more. I mean, I think we're all on the patient side at some point, whether it's now, whether it's before, whether it's sometime in the future. And so to, every day to approach it with empathy and with the real strong desire to combine your passion for medicine and wanting to be on the cutting edge of research to best take care of people, but really also just to, in your interactions with everyone, to be a good listener and to keep in mind that you're dealing with people who are in some of the scariest times of their lives or the most difficult times of their lives, and so the more that we can give to them and help them through that process, the better that we all come out kind of in the end. And I think that's one thing we really try and do here at Mount Sinai is really a collaborative approach to do that. And I think today having someone from each of our kind of sides of that is a real indication of that. But and that's what we're trying to do with the symposium as well.
I think that's what quality care is all about: compassion and empathy, and patient-centered approach. That's what it's needed. And Dr. Tewari, your final thoughts? We're out of time almost.
Very early in the journey, I realized that the surgical blade cannot sort out all the problems. There are cancers which need something beyond the knife. And that is what led me to start exploring into the genomics and the immunotherapy. And I feel literally humbled and very privileged that my patients allow me to work with them, teach me many things, and allow me to be part of their lives.
Right, so that's the second International Prostate Cancer Symposium, going to be held from September 6th through the 9th at the Mount Sinai Hospital, the Stern Auditorium on 1468 Madison Avenue on 100th Street. And I want to thank Dr. Ash Tewari, Chair of Urology at the Mount Sinai Health System, Anthony Lutz, who's a nurse practitioner there, and Mary Robinson, RN. She's a registered nurse as well. And thank you all for watching. It's so very important to know about men's health, prostate cancer health, so that you can help your near dear ones. I'm Renee Mehra. Thank you so much for watching the Renee Report. Welcome to the Renee Report, bringing you issues of topical interest.